All.
Because.
Of.
Cancer.
All.
Because.
Of.
Cancer.
I.
I
Was.
lost.
Angry.
Vulnerable.
Devastated.
My name is Keyshawn Knight. I'm 32 years old, currently recovering from stage 2 and stage 3 breast cancer.
My name is Denise Ziobrowski. I'm the mother of 4, and I'm a 2-time breast cancer survivor.
My name is Grace Guadalupe, and I am a mother of 5. I'm a stage 3 breast cancer survivor.
My name is Sharnae Jenkins. I'm a mother of 3. I'm the surviving daughter of Lorena Jenkins.
I remember my childhood was great. All of my sisters and brothers used to come to my mom's house. Me and my nieces was around the same ages, so we always went outside, played around with other neighbors, other kids. We used to have a lot of seafood boards. I love seafood. We just all around had a good time. We went from always being a close-knit family to going through everything in life together to losing each other one at a time. At the age of 12 years old, my mother was diagnosed with ovarian cancer. She passed away in March of 2000. That was a very hard time for me. And shortly after, in April, my sister passed away. And in May of 2000, my aunt passed away of breast cancer. So we was experiencing back-to-back deaths. And at that time, it was very hard. Very emotional, being young. After May of 2000, I moved in with my oldest sister in 2006, and she was diagnosed with ovarian cancer. So I had to watch her, take care of her since I was of age. And then shortly after she passed, and once she passed away, I just began to live my life. Just partying, drinking, doing what I thought was best for me. I was just trying to find my way.
Life was good. We just moved to Florida about 5 years before that. I had a full-time teaching job. My husband was working. We'd celebrated our 25th wedding anniversary. Life was good. It was fun. We were enjoying it, and things were calm.
Life before my diagnosis was pretty much normal. I had 2 kids out the house, 3 were with me. My older daughters were already married, and it was just a normal routine, work, school, normal day-to-day stuff.
Before my mom's cancer diagnosis, she was a hard worker. She loved to be around her family. She loved going to the beach. Water was her calm. She loved cooking. Just having family around was everything to her.
On December 29th, 2004, I went in for my routine mammogram. It was during the Christmas holidays, and we'd had a nice holiday. I had the mammogram first, and then they came back in and said that they wanted to take other films. So they did that, and then they said they wanted to take a sonogram. But I really wasn't alarmed until the nurse said to me, I think the doctor would like to come in to speak with you. I was laying on a table with nothing more than a towel over my chest. And I was looking up at the ceiling at the cork board and thinking, I don't really even know what this is, but whatever it is, I'm going to live with it. The doctor came in to talk to me, and I'm still laying there with just a towel flat on my back, and he said that they had noticed calcium deposits in 2 different spots on the breast. And so he said, 85% of the chance it's nothing, so please don't worry, but I still feel like it's a change and we should biopsy it. So he gave me the option of either a needle biopsy, and then the following week a needle biopsy, or 1 surgical biopsy. And the doctor told me to go home, talk it over with my husband, talk it over with friends, talk it over with whoever, and then call him back with my decision. And I thought to myself, wait a minute, I'm not going home to talk this over with anybody. I always knew the one person I could always rely on was myself. And I don't need to discuss this with anybody because this is happening to me. This isn't happening to anybody else. And so I said, I'll give you my decision right now. I would like to have a surgical biopsy. On February 7th, I got up early in the morning, very early. My husband was going to come with me for the biopsy, and my closest friend, Roxanne, who's a registered nurse. I got dressed and we left for the hospital. I was more nervous, I think, just about the surgery. I, at that point, never really thought, I'm going to go with my odds. 85% of the chance it's nothing. So we got to the hospital and they prepped me, and then we went into that awful x-ray room where they injected me in 2 different spots, and then they put a needle with a thread on the end, and they insert it until they can get to the spot. And the one spot wasn't too bad, but the one below was difficult, and that was hard. Then they gave me some sort of a shot or something. I fell asleep, and I was grateful to be out. I went in, and I don't really remember much. They give you what they call twilight, so you're not exactly out, but you're not really awake either. And the doctor talked me through it. It was done like in a half an hour. Got back to the room. I was sore. It hurt. I needed ice and things like that. But I went home in good spirits thinking, well, I've got the worst of it over. The biopsy's over, and I'm probably finished with this.
So on March 8th of 2010, I went in for my mammogram. I was kind of scared, okay, because it was my first mammogram. You hear a lot of horror stories, right? It's gonna hurt, it's gonna squeeze. Cancer was the least of my worries. It was kind of scary. I did the mammogram, but I was pointing out to the technician the area of concern that I had. So I pointed it out to her, and she focused in that area. First, when she focused in on the left breast where I felt the lump, she said, can you please wait? Can you go outside and just please wait? So I went outside and I said, okay, and I waited. So that made me a little bit concerned, right? And then she comes back and she says, first we have to do a sonogram on you. So a sonogram is going to be more of a deep tissue research on that particular area that you mentioned. So we went and did the sonogram, and it was just normal sonogram. And then she said, I need you to wait, and we're going to have the doctor review it. So I went back out, and now it's almost 2 hours. So now I'm really getting concerned, right? So I was like, why are they holding me hostage here? So then she comes back out and she says, we have a bit of a concern. So are you willing to stay and get a biopsy done? So then I thought, okay. So she took me to the back and they marked the area. They numbed it first, and then she says it's gonna hurt a little bit. It hurt a lot. And then they did the biopsy, and at that point I was like feeling very, very vulnerable. I'm like, okay, what's going on? I mean, this is 3 processes in one day. So I went home very concerned. You have to wait for the results, right? So I just went home a little distraught, but still having faith that I was gonna get a good outcome.
My mom's symptoms before she was diagnosed were she had a lump in her right breast. She asked me to feel it. It was irregular shaped, hard, and that's when she felt like she needed to go get a diagnosis or something was going on with her. The day that she went in to get a biopsy done, she was within spirits. She was calm. She believed in God, so she left everything into His hands. So she went in and got the diagnosis of, at that time, stage 4 breast cancer. She came back to work, which we worked at the same place, and let us know what the diagnosis was.
On February 2017, I was coming out from a long night with friends and partying and having a good time. And I was laying there asleep and I found a lump in my right breast. And the next day I told a friend, but I kept it quiet and I didn't tell anyone. And then roughly around that time in March or April, my dad got sick. So I pretty much put myself aside and found another lump in May while he was in and out of the hospital, but I didn't tell anyone. I just kept it to myself. At the time my dad was sick, he was diagnosed with colon cancer. They was able to get all of the cancer out. And when he was discharged to the rehab facility, 2 weeks into it, he got an infection that pretty much went down here from there. The reason why I got my breast checked was because I spoke to my dad. He was in and out of medical-induced comas. And when he finally woke up, I spoke to him. And he was just telling me, he said, baby, he said, go get checked, because I don't want you to go through what I went through. So then I thought he was okay. So now I could think about myself because he was out of the coma. And I scheduled an appointment and I went to see a doctor. On August 30th, I did a biopsy. I went in, I told her about both of the lumps that I have felt. She laid me down, she did an ultrasound, and she pretty much told me at the time that it was breast cancer, but I didn't want to believe it because it wasn't the actual testing. So after that, she sent me on my way, and she told me I should be receiving a call with the biopsy results. And I just left and was pretty much living life still, like I didn't have any lumps in my breast, waiting on a phone call. But the wait was horrible.
Now, as far as cancer itself, what I always tell patients is you're looking for a change. In other words, a woman can have a totally normal mammogram and can have totally normal studies, but if she has an inverted nipple or she sees a change in her breast, or even a man could actually, they don't get screening mammograms, but if they see a change in their breast, they need to get it checked out, because a normal mammogram is not equal to you don't have a cancer. It just means that you have an imaging study that's negative. But if there is a change in your examination, you really need to have it checked out. So how do you find a cancer? Well, a cancer can be detected by doing a self-breast exam, finding a lump, finding a change in the nipple, blood coming from your nipple, underneath your armpit. If you have a lump, because a lot of the time we will have a woman with a very dense breast that we may not see a cancer in the breast, but we may actually feel a large lymph node in her axilla, and that might be how this patient presents. Obviously, screening mammogram has come a really long way, and a patient goes for a mammogram and there's an abnormality, additional workup is done, we do a biopsy. Again, there's a change in her mammogram. And that's why whenever women go for mammograms, they always ask whether you have the previous films, because we're looking for changes.
On February 15th, I went to work as always. I was teaching that day. The only people that knew I was going to get the results were my principal and my team at school, as far as school went. I taught the full day. I can still see the clothes I had on, a chartreuse top and black bottoms. And I went through the whole day relaxed. You know, I thought whatever it is, but I was fairly confident I would be okay. And so I got in the car and I drove down to there, and my husband had wanted to come with me, Roxanne wanted to come with me, another friend wanted to come, but I didn't want anybody with me. I just felt like that's silly. If there's nothing wrong, they don't need to be there. But if there is, I want to react the way I want to react. I don't want, you know, them to see me upset if that's the case. And I wanted to own it. It was happening to me. So I went in to the waiting room, acted like there was nothing wrong, you know, just like I was there for a routine checkup. And they brought me in, and I got undressed and I sat on the table and I waited. And those few minutes you're wondering, what are they going to tell me? But 85% of the time, it's nothing. I kept saying that over and over again. All of a sudden, I'm sitting there, I hear the doctor and the nurse in the hallway, and they're whispering. And I knew that it probably was breast cancer. They walked in and the doctor came right up to me and put his hand on my knee and he said, "You have breast cancer." And I burst into tears. It was devastating news. And he said to me, "You have DCIS." And I was grateful that I had gotten on to the internet and had looked up that information that everybody told me not to, because they needed to, then I knew what they were talking about.
So March 12th was actually that Friday of that week. The waiting is very, very frustrating, right? Because you're waiting for an outcome that's gonna dictate your life, pretty much, right? So the phone rang. He said, "Someone's gonna call you." The phone rang, but I had already started my own little research as far as what type of procedures were available, what type of reconstructions were available. So I was pretty much ready. I had everything lined up. That's, I guess, the controlling mom in me, right? I already had picked one that was going to do the construction, one that was going to do the surgery. I had everybody all lined up just in case. So I get the phone call. And actually, it was not the hospital, but it was my OBGYN that called me, because he was the one that gave me the referral. So he called me to tell me, we have bad news. Tell me over the phone, it did come back positive. So the next step is you need to go see the oncologist, which I had already picked as well.
I was sitting at work and I called her on my lunch break. Normal, we talk all the time, and she said my biopsy came back positive. And I remember just freezing, and I was sitting at my desk and I said, "Oh my God, like, this isn't real." I sat there and processed. I had to work the whole shift. I was covering somebody else. And the whole day I just thought, "Oh my God, this is something you hear other families go through, not us." My mom, you know, and it was horrible, but we, you know, took it as it came, and it just started a uphill battle from there, but we got through it. That was the beginning of a very, very, very long chapter for us.
We are now in an era where your tumor biology dictates your care. And that's why it's so important. If you're diagnosed with breast cancer, you know, the internet is not your friend. Every woman is different, every cancer is different, everybody and their mother has a story for you. You have to recognize the fact that, you know, triple negative cancer is different than a grade 1 invasive ductal cancer. I mean, their tumor biologies are different, the way they're going to be treated are going to be different. So there is a lot going on out there. If you take a look at what's on the internet, it is not specific to the tumor biology that is your tumor biology. And you have to remember that. Every woman is different. Every woman has a different genetic profile, different family history. Their tumor may or may not have the estrogen receptor. I mean, there are so many variables in what you have to do for a patient that there is no way that the internet is going to be enough for you to make a decision. The best thing to do is, once you're diagnosed, talk to your team of physicians. Have them explain it to you. All right, they will be able to explain every minutia of your case. So when patients are diagnosed, I tell them 3 things. Number 1, this is not a death sentence. Most people survive their disease. Number 2, the internet is not your friend. And basically based on what I just told you. Number 3, everybody and their mother will have a story for you. Tell them, thank you for your good wishes. I'm gonna work with my doctors so that I can get the care I need.
When she had her first diagnosis, my mom was 35 years old. Her diagnosis was stage 4 breast cancer. The doctor's recommendations for the diagnosis was chemo and at that time surgery.
I was scheduled to get my results on September 6th of 2017. 2 days prior, on September 4th of 2017, approximately at 10 a.m., my dad passed away. So going into the office on September 6th, I had to hear the news that it was stage 2 and stage 3 breast cancer. At the time, I was angry, I was confused, I was crying, not really wanting to know if it was me next that was leaving. I tried to stay as positive, but it was just hard, because here I am, at the age of 31, losing another parent. So now I don't have a mother nor a dad to fight this disease.
I called my friend Roxanne and I told her, and of course she was shocked, but she's a registered nurse. She said she'd come over with a bunch of food, because she said, what about dinner? I said, Rox, if we're talking dinner, I don't care about dinner. And she said, I'll be right over. And so after that I drove home, and I knew I had to go in and tell my husband, and I opened the door and I was sniffing. He was sitting in another room. And the minute he heard me sniffing, he just said, oh no. I didn't even have to tell him. He already knew. After that, Roxanne came over and brought food. My kids came out. They knew, but they were very quiet. They didn't ask any questions, and their father reassured them that, you know, it was in an early stage, I would be okay. They filled their plates and went to their room. And we sat there and talked, and you know, I was calm. It was okay. I knew I was going to have surgery. It was scheduled. And then I asked my friend Roxanne, had she talked to my friend Debbie Jacobs? I said, Rox, did you call Jacobs and tell her? Because we were best friends. And she said, yes, and Jacobs wants to come down here to take care of you. And I said, absolutely not. I'm not letting her take a whole week off. And then it hit me. I said to my husband, I want to go home. I want to go home to my roots, to my family, to my friends. I want to go home. And he said to me, I promise you, when this is all over with, you can go home.
So I was most afraid of telling my children because I was afraid of looking and feeling in front of them vulnerable. I guess it was because of the fact that you might die. You're always going to confront the fact that you can die. And even though we have family, we're all together, but I needed to see them through life. So me telling them like something that's so unpredictable, right? Because you can die from the treatment, you can die from the cancer, it can spread. It's just so many what ifs that for them to understand it was going to be hard.
My response when she told me the diagnosis was I was shocked. At that time, I wasn't involved into the medical field, so I thought my mom is just not going to be with me anymore at that time. She was still within spirit. She cried, but I gave her a hug and she went to work right after.
I was keeping it to myself and didn't want to really worry my sister or my family because we had went through so much already. And here I am. At the time, she said it was breast cancer, but I just didn't want to believe it.
Everybody takes it differently. It so much depends on how the doctors break it to them. For example, in my practice, I will sit down, I will say, look, your pathology report came back as a cancer, but let me talk to you. Let me show you what you have. Let's figure out our plan. And literally, it's like, you have a cancer, but let me show you something. And if I believe that patient's going to do fine, I'm like, but you know what? You're going to be fine. So yes, you've been diagnosed with a cancer. It's small. Let's say it's a small lesion, for example. Let's come up with a plan. Let me show you your pathology. Let's talk about what workup you're going to have. And then let's talk a little bit about your surgical options. But those will come after we have had the diagnosis. Then you've got that other end of the spectrum where a patient comes in. She has a huge tumor. She has spread to her lymph nodes. You clinically see it. At that point, it's breaking the news to them about the type of cancer they have. But then you have to realize, if a woman has gotten to that point where the tumor is so large and the nodes are involved, there's a huge denial component. There has to be, right? So at that point, you sit down and you discuss the pathology. And then you go into, look, we've got to do a workup. Let's say it's a patient that has a huge tumor and they're not going to be surgically resectable. Then I will tell them, I'm going to do the workup, but you're going to need chemotherapy. But there are chemotherapy agents today that were not present 5 years ago that have come off clinical trials that can actually melt these tumors away. So just because you have this really large tumor, that doesn't mean that there's no hope. It basically means we've got work to do. So it really depends on how the patient's presenting. It really depends on the size of the tumor. It really depends on their support system. It really depends on their mental attitude.
On February 21st, I woke up really early. I was nervous, and but I was trying to keep calm. Roxanne didn't go with us that day. It was just my husband and me. And we got to the hospital, and they brought me right in and got me situated, and they gave me the same shot they'd given me 2 weeks before, and I fell asleep. All of a sudden, I wake up, and I started to cry. I just started to cry, and my husband said, "What are you crying for? You're going to be okay. Are you feeling bad?" I said, "Greg, I'm not feeling bad. I'm pissed. I'm pissed that I have to do this again. I just had surgery. I'm just starting to feel better, and now I have to do it, and only for a different reason. I have to, I was angry. I was in the angry stage. And then they brought me into surgery, and I came back, and the first one I reached for is Greg. Greg, he said, everything's fine. They've removed whatever they needed to remove. You're going to rest a little bit. They brought me some ginger ale and some things, and I felt relief. It was over, as far as I was concerned. It was cut off. It was done. I went home that same day, and I had something to eat and went to bed. As far as the radiation goes, I was reluctant to have it. I felt like, well, it's cut out of me. What do I need radiation for? But the doctor assured me that I really should. There could be a stray cell, there could be something, and it was preventative. Because usually with breast cancer, if you get it in one breast, if it comes back, it's usually the same breast. So they brought me into this room the first day because they have to mark the spot. You don't have radiation the first day, but they need to find out where exactly it is, and so that they can mark it when they're doing it. And they came in, again, I'm laying there with no top on, and they took this big royal blue magic marker and just made X's and O's all over my chest in the front of me. And I thought, I feel like a piece of meat being ready to be packaged. I mean, it was just upsetting and sad. And then they told me they did tattooing where they put little dots so they get it exactly right. And then they sent me home. Then I started like 2 days later. And the radiation, I remember the first time I went, I was laying there and the machine started and it goes over you and then it comes back. And you can't move. And as it went over me, I could feel myself starting to cry and said to myself, how did I get here? How is this happening to me? How could I be laying on this table having this happen to me? But I thought, I better stop crying because if I move, it's going to mess it up. And so I had to go for those treatments every day for 6 weeks.
So in the process of prepping for chemo and waiting for the surgery, because it was chemo first, I decided to downsize the household. So we moved completely from a 3,000 square foot big house to a small 900 square foot house so that we can go through the process and have the least economical impact to the family. So we decided to downsize, we decided to cut all the corners that we could, because even though my husband works, he's in construction, so I'm like the main steady income. So we decided, okay, the best thing we can do is so that nobody feels the impact is just let's move to a smaller house, put stuff in storage, and just prep for the surgery. The treatment that was recommended was the double mastectomy because of the fact that the cancer had already spread. So it didn't come back positive on my right breast, but just to be preventative, it was best to do a double mastectomy. Then after the surgery of the mastectomy would be the chemo, and then based on the lymph nodes, then they would recommend radiation. And then a follow-up chemo medication treatment for about 10 years. That was the plan.
The summer of 2001, my mom had a mastectomy done to her right breast. She had chemo prior and then the surgery. And in October 2001, she was recovering from the surgery. The recovering process for my mom at that time was painful. She was scared to eat. She cried. She couldn't celebrate her granddaughter's first birthday. Emotional for the both of us. After the surgery and the reconstructive surgery she had for her breast cancer, she did great. She went back to her regular life, working hard. 13 years later, she started having some pain in 2014, the beginning. Undescribable pain. She started having weight loss, over 20 pounds weight loss. The pain in her legs were unbearable. She couldn't walk at times.
The doctor's recommendations, after we spoke about it, as far as the stages, stage 2 and stage 3, the doctor stated that I was gonna immediately start chemotherapy. Then I was gonna do a double mastectomy with the surgery, and then I was gonna do radiation. With the chemotherapy, they said it was gonna be 16 rounds of treatments, and the first 4 rounds gonna be very intense. The last few rounds was gonna be much easier, which it wasn't. But the fact that I had to face losing both breasts, it was hard, but I had accepted it because it was either my breast or my life, so I had to choose. And after that, I was going into radiation.
In the beginning of radiation, there weren't many side effects. Some women get tired. I didn't. I was okay. But after 3 weeks, I noticed discomfort. I was in kind of pain. And then I realized, they're burning me. My skin is burned. And it was all discolored. And so I talked to the nurse there, and she told me aloe, straight aloe would work. And I'd keep it in my fridge. And the minute I'd walk through the door, I'd pull my shirt up, pull my bra off, lather it on. It was the only relief I could get. But other than your skin, I did really well through the treatments, I think. I did fine. I went to an oncologist, and I would go to him once every 6 months. And the oncologist put me on tamoxifen, which is pretty standard. And I took it for about a year, and then I stopped. It was just too, I was getting hot flashes, and I just thought, I really don't need this, and he agreed. But I saw him every year, and of course they would take my blood, and everything would be fine. So after about I think the third or fourth year, he said I didn't have to come back. But as far as when you really realize it, to me, once the surgery was over, once radiation was over, and I went back for that next checkup, I was cured. And I felt confident that I would be fine, and I would never have another problem with it.
So on March 25th, when I chose my reconstruction, the day of the surgery, it was going to be a 12-hour surgery. We were going to have the double mastectomy performed. We were going to have the reconstruction of the breasts at the same time. But that's when they discovered that the cancer had spread to my lymph nodes, because I guess there were some signs of it spreading. So they performed a biopsy of the lymph nodes, and during the surgery, they were going to check first the lymph nodes. If the lymph nodes didn't have cancer, then we can proceed with the reconstruction. But if they did, then that would change the whole process. We would have to wait, do chemo, do radiation, and then come back and do the reconstruction. So my surgeon, she did the double mastectomy. That went well. She took out the lymph nodes. There was 11 lymph nodes removed from underneath my arm. And out of the 11, I believe 7 of them came back positive with cancer. So the plastic surgeon was in the surgery as well, because it was going to be a 12-hour one shot. But he got a little bit, I guess, anxious during the process, and he was supposed to wait for the lymph nodes to come back. He didn't, and he started cutting my stomach because I selected the reconstruction with your own fat, so that they take all the fat out of your stomach and they use it to reconstruct your breasts. So to me, it was like the most natural form of the reconstruction process. But since he didn't wait, he started cutting the stomach to prep the stomach for the surgery. And it came back that, oh, no, she's got cancer in her lymph nodes. That means that possible radiation is needs to take place. So he had to sew back my entire stomach, which he had done like a big old happy face in my stomach to be able to extract all the fat from it, which there wasn't that much fat, but there was fat there. And he had to sew it all back up, and they had to put in what's called spacers in my breast cavities, those are like saline breasts, which are really hard and they're really painful, to be able to save my space until I went through chemo, and then possible radiation, and then the reconstruction. So when I woke up from the surgery, it was a lot of pain. I was, when the nurse came to me and she told me, because I was asking questions, I became angry. I was angry because it's like, why do I have all this pain in my stomach when it's my breast that are supposed to be cut off? And then they proceeded to explain to me that the doctor the plastic surgeon had started his surgery, and that he had sewed it all up and I had to wait. So then there was the concern when my surgeon came in. She's like, the concern of the fact that your skin's not going to heal properly, because now you're going to undergo all this chemo. So that's not going to allow the scar. So now you can no longer have your own reconstruction with your own fat. We're going to have to go to plan B. It was frustrating. I was angry, but then I was also worried, because now to be honest, I didn't even know what lymph nodes were or where they were, but I know they had cancer. So it was a lot of information to take in. So on April 14th, when I went to do my first chemo, Everything was done at the hospital, at the same MD Anderson hospital where I did my surgery. And there's a lot of people there already getting chemo, all ages, not only strictly breast cancer. So I didn't know what to expect. I didn't know if it was gonna hurt. I didn't know if it was gonna burn. I didn't know what to expect. So you're really anxious and you're nervous and you're just waiting. Then you see, you're basically like a number through the whole beginning of the process, right? And then I see the nurses with all this covering and all this extra protection while they're carrying this orange bag that is what they're gonna pump in you, right? So then I'm really scared because I'm like, boy, she's acting that way, so that must be total like venom danger and it's gonna come into my body. So when they first put it, so before I started the chemo, they did the port. They opened up the skin and they put in a port inside of me so that way they can access my port every time I went to chemo, because it was gonna be such a long time frame for chemo. So instead of doing, since your veins, they dry up, they do a port on your hands, but that's only for like a couple of months. But since mine was gonna be so long, they did an internal port. So the nurse, she comes in and she pokes a big needle inside your chest cavity and she finds the entrance of the port, and then through there they connect the needle and they feed you the chemo. So the time frame between chemo and my reconstruction was about 2 months that I had in between. And it was because I think it was the holidays were near, and so they decided to just give me a break, let the body re-heal. And then the fact that I was trying to heal also my stomach. We were trying to see if we can save the skin of the stomach to do the reconstruction that I had requested, but by the time it was time, and the skin in the stomach area was not good. It had suffered too much with the chemo.
In August of 2014, I was scheduled to go on a trip for my birthday. That day, my mom was in so much pain. She just was tired of going through the pain. So she not only asked me, but I wanted to take her to the hospital to find out what was wrong. We went to the emergency room that day. They took CAT scans. They basically they gave her morphine to get her out the pain that she was in. Once we got the diagnosis back, they said that the cancer had came back. It was stage 4 bone cancer, mainly in her pelvis bones. At that time, she knew something was wrong. She kind of knew it was the cancer that came back because she lost a lot of weight. She couldn't tell me why the pain was there. And on top of that, the medication that she was supposed to take for 10 years, she didn't take because it was too expensive at the time. The insurance that she had wouldn't cover it. So she had to make a choice between herself or her kids. So she chose her kids.
I started chemotherapy on October 5th of 2017. My last treatment date was on February 22nd of 2018. February 22nd was a wonderful goal accomplishment for chemotherapy. I was able to ring a bell, and once that was completed, I was scheduled to have a double mastectomy on April 19th of 2018. During the time period of waiting, I was pretty much trying to rebuild my strength back after the chemotherapy, and just mentally trying to prepare myself of losing both breasts and just facing the fact if I was to ever have a child, I wouldn't be able to breastfeed. So it was a difficult time.
In October 2012, I went for my annual mammogram. You're always a little apprehensive after you've had breast cancer, but I was okay. I went in, it was Halloween, and I had my regular mammogram, and when it was over, with that, they read the films. Then they came back and said that they wanted to do ultrasound, which wasn't unusual. That's usually the way it went for me. They did the ultrasound. And I had asked them before I went that I wanted what they call the wet reading. The radiologist looks at it right then and there, reads it, and if there's anything that needs to be taken care of, she tells you. So they told me to go ahead and get dressed and wait. And then she came back and she said, the radiologist wants to see you. And I said, did they do the wet reading? And she said, just come with me. And when I went into the room, there were my films and ultrasound splattered all over the screen. And she said, there's something small that we see. And of course, my heart sank. And she said, it's only about 1 centimeter. It's very small. And she said, but I think you should have a biopsy. And I said, a surgical biopsy? Because I'd been through that before. And she said, no, it's in such an area that I think you need a needle biopsy. And so you need to get with a surgeon or she said, we'll do the needle biopsy here. And if it's nothing, then you can go on from there. And I said, will you do it? And she said, yes, she would. So that was the day of the mammogram. November 29th, I was laying in bed with my husband. It was early morning, and I sleep on my stomach. And the phone rang early. And I answered it. It was the doctor's office. And they asked, could I come in? And I was frightened. I could feel my heart pounding on the bed and almost hear it. And of course I panicked and I said, well, is it cancer? And she said, well, the doctor really needs to speak to you. So I quickly woke up my husband and I said, we need to get to the doctor's office. They called me and they won't tell me anything. So we rushed, got there. In came the doctor with the nurse and she said, you have breast cancer. Only this time it's not DCIS, it's invasive lobular carcinoma. And my heart sank. I felt like I was punched in the stomach, slapped in the face. I was almost in disbelief. And then she said, normally, if this was your first time, we could do a lumpectomy with radiation, but because you've had radiation before, we can't do it that way. So you're looking at a mastectomy. And I was completely shocked, numb. I was nervous and upset because at that point I had had to make the very difficult decision of having both of my breasts removed, even though the other one had no cancer. And that wasn't an easy decision to make. The parish priest had come over and talked to me, and I just said, he said, how are you feeling about it? And I said, well, I'm not happy about it, but my breasts don't define who I am. And with that, I knew I'd made the choice to have them both removed. But on that day, I was frightened. I'd been begging and begging for courage, begging God every night for courage for me to do it, because I knew I was about to lose my breasts. So I went in, not knowing how I was going to feel afterward, but at that point I knew the breasts had to come off. I'd made the decision to have the other one off. And I woke up and I was sleepy and groggy, and I remember asking for my husband, telling him I loved him, telling my friend I loved her. And then they left and I slept. And I was relieved it was over. I did have reconstruction. I made that choice. There's more than one way of having it, but I chose expanders, where I would go once every 2 weeks and have them filled with water. And that is not actually painful when they prick it, but as your skin stretches, it can be uncomfortable. And then after that, they remove the expanders and put in permanent implants.
Now, when a patient is diagnosed with breast cancer, what are the surgical options? Again, it depends on the presentation. If you have a woman with a large tumor or who has nodes that are involved, or a patient who may have a small tumor but who has a really small breast, those patients are not surgical candidates. Those patients will go on to chemotherapy first. The purpose of that is to try to get control of the disease and also to try to shrink the tumor so that we can now remove the breast or remove the tumor or whatever. Now, let's say it's a woman that we found a small tumor in a mammogram, right? And her workup was negative. So that patient could easily have a lumpectomy. A lumpectomy is where you remove the cancer itself. But again, we have to clear the margins. A lumpectomy you have to do with radiation. They're a package deal. If you don't do radiation for the invasive ductal cancers, when you do a lumpectomy, there's almost a 40% risk of a reoccurrence. Now, the next surgical option is a mastectomy. A mastectomy is basically the removal of the breast. Now, there's a simple mastectomy, which is where you don't touch the lymph nodes, but you remove the breast. And there's a modified radical mastectomy, because where you remove the breast, but you also check the lymph nodes. So at this point, if a patient wants to have a mastectomy with reconstruction, we can save their skin. And in small-breasted women, we can even save their nipple. The plastic surgeon comes in after me, and they then go ahead and do the reconstruction. As far as the reconstruction itself, over 90% of the patients in this country actually get an implant. There are patients who will say, you know what, I don't want reconstruction. I don't want to deal with this, I'm done. They'll get a mastectomy where they'll actually just have a scar across their chest wall. And then they can have a prosthesis that it's basically a bra where you tuck in a prosthetic, and they're perfectly fine.
My mom continued with the chemotherapy from 2015 to her last chemo was November of 2017. Her markers were continuously going down at that time, and we had nothing but good prognosis at that time. In December of 2017, the actual date was the 3rd of December, she suffered a stroke. I was at work at that time, and I got a phone call from my daughter, my oldest daughter, and she stated that something was wrong with her grandma. So I asked her to put my brother on the phone, and my brother said she's just acting funny. She's walking, she's sliding her leg, she's just disoriented. She doesn't know what's going on. So at that time I was at work, and I was in an emergency as well with one of my patients. But I told my supervisor I had to go. Something was going on with my mom. So she took over my emergency, and I went home. My brother said he had called 911, and I got home. They were pulling up as I was pulling up, and they were in the room. I let them go through the house to get to her, and I just yelled out and just told her I was here so she'll know that I made it home before she left. We went to the emergency room at the trauma unit. My Aunt Jenny was there, my Aunt Lila was there, and they just did what they needed to do at that time to get her situated, get her stable. And the doctors asked me at that time, we need you to make a decision. Whether we need to go after the blood clot or just let her be. Either way, it was a prognosis of death. So I made a decision. Doesn't matter which one I choose, it's going to be, I'm going to choose life for her. So you need to go after the blood clot. They went after the blood clot. They took her into surgery, and probably a good hour later, all the family was there to the hospital. And we also have family in New York, which was on the telephone with multiple people that were there, so they would know what the prognosis was at that time. She came out of surgery, they got the clot. She went into ICU at that time, and they got her stable in ICU. They allowed family to come back just to say hello, not to be in there too long. So, and she was up and talking, and she knew who everybody was, and no effects or anything from the bleed, because she had a bleed on her right side of her brain, which affected speech, which affected breathing. She stayed in ICU for 3 days. Then she went down to the step-down unit, and she was walking with therapy, no side effects, no paralyzation. Once she got down to the step-down unit, they did physical therapy, started physical therapy. She walked maybe 50 feet and came back to her room, and she said, something feels funny. And I said, what's wrong, Mommy? And she said, help me go to the bathroom. So I went and tried to help her out of bed, and I just seen her mouth twist, and her arm, her right arm lost function. So she wasn't able to get out the bed to go to the bathroom. So they called another stroke alert for her, did another CAT scan, and nothing changed. They just said it was the residual of the stroke at that time. December 7th, she was discharged from the hospital. She went to the rehab. They started therapy. They started getting her to walk again. They started only thing was wrong with her was her right arm wasn't full. She couldn't use her full effects of her right arm. So they just did therapy as far as walking and getting her strength back, and showing her how to get out the bed, and showing her how to put one foot in front of the other. Once they got her stable with the walking, they started doing therapy, extensive therapy with her right arm trying to get the motion, the movement back into that arm. At that time, my concern wasn't the cancer. The concern was, getting her back on her feet and everything like that. So she took something was going on with her, and right after Christmas, she had a change in condition. So we sent her to the hospital, and in the hospital, that's when she gained functioning in her right arm. Something that we didn't even see. I was getting her out the bed to get her washed up and, put on a new gown and change her linens on her bed. And she just looked at me and said, look. And she moved her arm. And I said, Mommy, you can move your arm? She said, yes, watch. And she moved her arm and everything. And I was like, wow. And I showed her nurses and everything. Everybody was in awe, like, wow. She was discharged from that hospital stay going into the new year. So December 31st, she came back to the rehab. And then me and my daughters came up. I worked that night, but me and my daughters came up early so we can bring it to the new year with her, so she wouldn't be alone when the new year came in. She took another change in condition in February of 2018. And the nurse practitioner that I've been working with for a while wanted to get another CT scan done, because at that time she hasn't had therapy since November. So we sent her to the hospital, and that's when we knew the cancer had spread it more. And at that time it spread it to her liver, into her pelvis, and in areas of her stomach as well. The doctor that I've been working with for the time that I've been at this rehab, basically asked me, hey, do you think we need to consider hospice? And I told him, just let me, just wait a minute, let me talk to her about it, and we'll go from there. So once we went to the hospital and she heard the diagnosis of the cancer spread it more, she was very hurt, very, not the point of giving up, but she was like weak. Like nothing that I can do would make this go away. No matter how strong I am, if she felt like it was her destiny to not fight it, not survive it. So while she was in the hospital in the emergency room, once they gave us the diagnoses that it spread more, she kind of gave me this look of a child and said, "How long do I have to live?" And I couldn't answer her because I don't know. I can only tell her that I'm just here. So she's seen the emotion in my face, and everything that she felt at that time of dying just went out the door, because she just wanted us as her kids to be happy. So when she seen the emotion in my face, she kind of said, "No, I'm gonna be okay. I'm gonna be okay. Don't cry. I'm gonna be okay. I'm gonna still fight." A week before she was getting ready to come home, she took ill. She got really weak. And I told her that we was remodeling the house for her. And she was really happy about coming home. She I kind of wanted to surprise her with, new furniture, new paint, redoing her room, just giving her a different atmosphere to come home to. So we did that, and I stayed visiting her, letting her know how we were doing with the house and things like that. So, I told her, show her pictures of furniture, and she'd show me, "I don't like that one, do the other one," and things like that. She just could give me her opinion. But she took ill the last week. She got really dehydrated. She kind of stopped eating. But once we told her she was getting ready to get discharged, she kind of got a burst of energy. She got discharged on March 23rd, and we brought her home. And on March 24th, we gave her a surprise homecoming party. She interacted with her grandkids. She interacted with all the family. Easter Sunday was her last time she got up in a wheelchair. On April 7th, while I was at work, I got a phone call about 11:30. I was out of work all that week, and this was my first day back to work. And I got the phone call from my brother. He said, "Mommy's breathing funny." So I said, "What do you mean she's breathing funny?" He said, she's gasping for air. So I called hospice and let them know that something was going on with my mom. And I went home and I found my mom basically gasping for air, like she was about to take her last breath. At that time, I told my brother, "We need to prepare. This is the time." And his expression was lifeless. Like, I just took everything out of him. I climbed into bed with my mom. I rubbed her. I encouraged her it was okay, that everybody was here. I already made the phone calls to the family, and family was on the way. At that time, I just was rubbing her hands, rubbing her hair, just letting her know it was okay. And then I started feeling people rubbing on me. And I knew, the family was there to get us through this process. She took her breath at 10 minutes before 1 in the morning. And mostly the entire family was in the house when she took her last breath.
My first thought when they took off the bandages on my breast was I went from large breasts to no breasts. And I kind of didn't soak in it. I didn't get upset about it. I just found the way for me to accept that that was my new normal. This was how my life was going to be. This is how it was going to look. And I just didn't allow it to define me as a woman. When I first lost my hair, the way I felt about it was I took it as being rebirthed again. I was born with no hair, so I was like, okay, well, if I lose my hair, then it's my second chance at life, pretty much. But then I knew what to expect because I watched my mom go through it, I watched my sister go through it, so I knew losing hair was part of the process. So I didn't let it overwhelm me. But on the day that I actually cut my hair off, I took many pictures. I laughed about it, and I just didn't let it get the best of me. I just said it's just hair and it's gonna grow back once all this is over. The reason why I didn't want anyone to be sad around me because I didn't feel sorry for myself. I never said, why me? I always said, why not me? So I wasn't gonna allow anyone to come in my space and make me feel bad about something that I had to face or something I had to fight because I felt like it was just gonna make me weak. So I didn't have time for negative energy. And at this point, I'm living my best life. And I just didn't have time for the sadness or the tears.
So the day of my reconstruction surgery was excitement. I was excited, but I was a little bit of upset at the same time because I had learned, again, that the fat wasn't good. So we were going to go and move towards silicone. So it was a relief because they took out those saline spacers that were very, very painful. And it was just an exciting, more of a worrisome day. Like, you know, how is it going to end up? The mentality, when you think, a lot of people, when you say you have breast cancer and you have a reconstruction, there's a lot of images out there, right? So there's some people have breasts, some people don't have breasts. Some people have perfect breasts because the reconstruction is perfect. But there's still that, what are they going to look like? Right? So because my breast cancer was in the nipple, I needed a whole nipple reconstruction. So he had to take out my real ones, make some. Then you have to decide, do I want a tattoo? Do I want a skin one? How, you know, there's a lot of choices you got to make. So it was an exciting moment because finally you feel like, okay, it's done. I'm going to go back to being almost normal, right? I'm going to have my breast. Losing my hair, for me, it was traumatizing. So some patients, when you have your gatherings during your chemo or during your visitations to the hospital, everybody's upset about the breast. I'm losing my breast, I lose my femininity. And to me, it was my hair. To me, losing my hair, losing my eyebrows, losing my lashes was so traumatizing. It was like, it was losing my identity. It was who I've been paying so hard and so long to be. So it was very traumatizing. My hair was very traumatizing, more than the breast. When the doctors advised me at the 5-year mark after the whole ordeal that I was cancer-free, it was a relief. It was a relief. You were still within the radar because they keep you under their radar for about 10 years. But it was, you feel relief. You feel some sense of, it's almost back to normal. I'm out the woods for at least for a little bit.
So when patients have surgery and lumpectomy and then they go on the pill, they have to recognize a very important fact. You have to stay on the pill for your time. Sometimes what happens is compliance is an issue. So patients will start to have joint pain and this and that. The reality is if you have side effects, the data shows that you will do better. Those patients will have a better survival in the long run. But a lot of patients, because their joints hurt and this and that, and if they're a year out and they feel great, all of a sudden they're like, oh, I don't want to do this. It's affecting my quality of life. I don't want to do the pill anymore. If you don't take the pill, there's an increased risk of a cancer coming back. I think one of the greatest gifts to the world of breast oncology has been the development of genetics. Why? Because we are now able to identify people who are genetic carriers of a gene mutation. Think about this for a family or for a patient. Let's say, her mother died young, okay? And then her sister died young, and her aunt died young, and her grandmother died young. And you are literally growing up in a family where you, by the time you're 18, have attended all these funerals. So these are patients we know are genetic carriers, but they don't get genetic testing done. But let's say they did. Let's look at a case and let's say that person got genetic testing done when they turned 18. We can then sit down with that patient and say, look, yes, these people died from their breast, their ovarian, or whatever cancer that they had, but you don't have to do that. You see, we know you're a carrier, so let's be proactive. Let's say it's a young patient, just for argument's sake, okay? I mean, that's not a patient that wants a bilateral mastectomy at 18 or hysterectomy at 18. I've had patients who are 21, 22, who diagnosed at 18 with a genetic mutation. We watch them, they're 22, they're like, okay, I'm ready. Like, okay, let's go. And there are other patients who are here, have been in our practice for 15 years that are carriers, and they're not there yet. But they haven't, we're watching them carefully. They have not developed a cancer yet, and so we will continue to monitor them. And then there are patients who we did observation, and then sure enough, we found a cancer, but we found it very early because they're in observation. So those patients, okay, it's time. Let's get it done, and we do.
My support system was my family. They pretty much dropped everything. I never had to go to any appointments alone, any chemotherapy appointments. They just always called me, checked on me, make sure I didn't need anything. They forced me to eat when I really wasn't hungry. And they pretty much just took me out. I had a friend that took me out every Friday just to get my mind off things. And my brothers, they were so amazing. My sisters, they was great support as well. Once I got to the hospital to prep for surgery, I had about 15 family members there. We prayed, we laughed. I was so nervous. They had to find a vein because taking chemotherapy, my veins was very small. And I was just nervous, I was shaking. I was trying to stay positive, I prayed. And then finally it was time for them to just take me back.
My whole family was a support group. But I had two aunts that were amazing. My Aunt Jenny and my Aunt Lila. My Aunt Jenny's a nurse, and she was the extra nurse in this process. She was also that one that would come and aggravate my mom to the point where she was just like, I'll just do it. Where she didn't have an appetite, or my aunt would just, oh, you have to eat, you're gonna get weak. Just try a little yogurt. And my mom like, no, I'm not hungry. And she'll just continue to go on with it, like just take a bite, something. And mom was like, okay, you're just you're not gonna stop, and just let me take a bite of it so it could shut you up, basically. My Aunt Lila was more of an emotional support. She would come over. If my mom was in the kitchen cooking, she would go in the kitchen and help her. If my mom was cleaning, she would come and try to help her clean. And my mom was like, no, you sit down. That's not what you came over here for. And she just was so independent and so strong, to the point where even when she was weak, she was still strong. Even though the whole entire family was amazing, those two stood out because times where I couldn't make the appointment, or I just couldn't miss another day of work, they would say, no, you go to work. You still have your bills to pay. We'll take time off and we'll take her to her appointments, or we'll take her to, take her grocery shopping, or take her out to eat just to get her out the house. They would come and do things like that for me.
After we received the diagnosis of her mother's cancer spreading, Charnay and I went to Key West for her birthday. Just being there with her I didn't know the struggle she was going through. I didn't know the conversation she'd had with her mother, but she was always upbeat and playful as usual while we were on vacation in Key West, until I found out after her mom's passing, when she did her speech at the funeral, that she actually had some low points in private. It wasn't difficult for me to be there for her, because as a friend, that's what I'm supposed to do as a best friend, but it was difficult watching her go through the transitions. Because she's such a loving and caring person, and her and her mother were very close, so the entire family is actually very close, so to watch them, because to go through it was, heartbreaking.
My immediate family, during the chemo process, we came together more because I'm a big advocate of the family sticking together, like brothers and sisters, we're it. And then my extended family, everybody contributed. We all became like one unit. So they took turns with the kids for school. One was cooking, one was cleaning, doing the groceries. My daughter was, Clarissa was the one that went with me every single month throughout her whole 9-month pregnancy to chemo. She was my chemo buddy. And we became more of a unit, more of a tight family.
After my mother's diagnosis, my siblings felt lost, some more than others. We have a younger brother who was starting his teens at that time, and then my mom was diagnosed, so he was going through that, and then my mom's diagnosis. So I think of all of us, he took it the hardest. We didn't know what was coming. We were lost. I don't know how to explain it, it was awful. We felt like we wanted to do more, but there was only so much that we could do. She's our rock. She is, I'm sick, call mom. The baby has a fever, call mom. Mom knows what to do, So it was weird to see her go through so much pain in such a fast time, because she was diagnosed in March and she was already having her surgery. I think maybe 2 weeks later, 3 weeks later, she was already having her double mastectomy. It was so fast, we didn't have time to process it. It was something we couldn't prepare for. And seeing her, my mom was vulnerable, but always strong. Even after surgery in the hospital, she was always, attentive to everybody else. Are you okay? How's everybody? How's the house? Even after surgery, stay home and rest. She was up and mopping before she was supposed to be up doing anything else. So it was hard for all of us. There's 5 of us, 3 girls, and we wanted to help, but it was just, we weren't used to seeing her that way. It was hard.
I think that as part of the team of any patient, we, doctors and such, we're just a part of it. The bigger part is the family. It really is. It helps in the mental aspect of how they get through this disease. Then there are children involved, right? So here's what the data shows, and that's one of my bigger passions. And that's why the Mitu and Lee Learn About Breast Cancer book that I wrote for children, the inspiration came from this. The children as young as 5, they know what's going on. But the thing is, parents try to shield them. And the data shows, there's scant data, but the data shows that these children in homes that have been diagnosed with breast cancer, if they don't know what's going on, and if there is that whole reality that they've created in their own head about what these changes are, they have an increased risk of psychosocial issues and detachment issues long after the family has dealt with a diagnosis. Open communication. You need to sit down with your children. You need to tell them that you have been diagnosed with breast cancer. They need to know what changes to expect, right, in their environment. Sitting there hush hush crying, and words like chemotherapy and radiation and surgery are scary because these kids hear you. But if you sit them down in a contained, warm family environment and say, look, I've been diagnosed with breast cancer. These are my doctors. This is what they're telling me. They're telling me I'm going to be fine. These are the things we're going to expect. I need you to help me around the house. You're going to see my hair is going to fall off if they're going into treatment. Prepare your children. Inform your children. Make them part of your team. And guess what will happen? You will probably have the best support team anywhere. I truly believe this. 80% is how you handle the disease in your head, and 20% is what we all do for you. The human body is extraordinary. We know this. We know that patients who are calmer, they do meditation, they exercise, they spend time with their friends and family, and they're doing their work, their job. Those are the patients that do better than patients who are depressed, introverted, in a room by themselves. And that depression only worsens because you have the fatigue. You have the fatigue of the cancer and the chemotherapy. You have the fatigue of, the throwing up, and you've got that sort of that dark cloud in your head that you just can't get out of your own head. And that's a dangerous place to be. So I always tell patients, you know what? Go ahead, work through chemo, work through radiation, do whatever you need to do.
My advice to anyone that's going through this process would be take it one day at a time. Whatever you feel that day, just let it come out. If you feel like crying that day, cry. If you feel like screaming that day, scream. You feel like taking a drive, take that drive. You have to take one day at a time, because if you don't, you'll become overwhelmed, you'll become anxious, and you'll become sick. And that's nothing you want to go through. So just know that the process to healing is slow. The process to get back on your feet is slow, but it's possible. It's you're able to do everything you needed to do before that person passed. It's just a feeling of emptiness, the feeling of the time that you have with your loved ones. Take quality time out with them. It's not about how much time you spend with them, it's about the time that you have with them. You love on them as much as you can, because once they're gone, you can't get that time back. Continue to encourage them while they're going through this process. Continue to let them know that everything's going to be okay, and to also talk to them about the time where they're not going to be here, to let them know, hey, you're not going to be here. I'm going to be heartbroken, but I'm going to be okay. Sometimes they need to hear that it's okay to leave. It's okay to go. Some people fight just to stay here for somebody, until they hear those words of, Mommy, it's okay. It's okay to go. God's calling you, so you can go. That's when they can release and be at peace.
Talk to someone they trust if they need help making the decision. Talk to their doctor, talk to their husband. But nobody knows you better than yourself. So, and to have courage and to be, realize that when it's all over, because it will be over, that there is life after breast cancer. There's, so much joy and so much giving that they can do. But while they go through it, to just take one day at a time, not to look too far into the future, but not to look back either. And talk to people that they trust, and pick the choice that's right for them. Not every woman is going to pick the same choice. Not every woman feels the same way. And that would be the best advice I could give. To make their own choice, stick with it, and not explain why they did it that way.
So when you're diagnosed with breast cancer, what would be my advice? The first thing I would do is do what you have to do. Cry, have a pity party, do whatever you need to do. But then come back to reality and recognize three things. Number one, most people survive their disease. Number two, it is not a walk in the park, but it's a temporary thing. You're going to be diagnosed, you're going to do your treatment, you're going to get your life back, and you will actually be in a different place in your head. And the third thing I would say to them is this: be strong, because there are so many people supporting you within the healthcare community. your surgeon, your medical oncologist, your radiation oncologist, I promise you, we are in this to be your advocates. We're in this to fight your battle with you. We're in this to save your life so you can have a happy, normal life.
The advice I would give friends for their friends going through the process of someone with cancer is to be there. Be there for them, be a listening ear, be very strong while they are going through the different cycles of grief, because it's going to be very hard for them and you as well. So take care of you as well.
My second chance at life. Right now, I'm forever grateful. I wake up with a positive attitude. When times get hard, I pray. I get on my knees, I cry, but I know I'm going to get through it. And I just don't take life for granted anymore. I just do everything I want to do, even if it's by myself, I do it. I'll take trips. I just enjoy life. And I just live it.
Do what your doctor tells you. If you're at a certain age or at a certain risk for breast cancer, then follow doctor's orders, because I was the healthiest person you can think of. I don't smoke, I don't drink, I exercise, I go to sleep at 8 o'clock at night. And for me to have found the breast cancer and gone through the whole ordeal, and going from a normal, healthy person to now watching every breath that you take, every pain that you get, any little lump, discoloration that you have in your body, it's a big change. It's a big life changer. So I would tell anybody out there, just do your self-exams, do your mammograms. Anything that's not normal, your body talks to you. And there's nothing more communicative with you and your body. It tells you, I don't feel well, I hurt, there's something wrong. So listen to your body.
The way I see my mom now that she's 100% recovered is stronger than ever. She's always been a fighter, so we knew that she was gonna get through it, but right now she appreciates everything more. We appreciate her more. She is much more free will. She's more, we're traveling more, doing a lot more stuff that before it was something that was on the back burner, and for us now it's a priority. Family dinners, get-togethers, parties, just because, pop-ups, grandkids. It's just, I see her more, it's more unity in all of us. Any advice that I would give to children that are going through what we went through is to talk about it. It was hard for us to go through it as a family, but talking about it helped. It's not something that you want to keep bottled up. It's something that needs to be discussed. What to anticipate, what's coming up next, have a game plan. It's, having a positive attitude is what you have to have. You can't let yourself be defeated, because when they see that, that's what they feed off of. So as long as everybody's on the same page and everybody is 100% positive and 100% willing to contribute to what's coming, it makes it a lot easier for everyone. But definitely you have to talk about it, because if you don't talk about it, it brings emotions that keep bottled up, and even after everything is done, it just comes out and it's 10 times worse. So you have to be open, ask questions, talk about it. We talked all the time with my mom. She was open with everything that was going on, what was next. So you just have to be 100% open.
The advice that I have for a person that's going through breast cancer, my age or younger, is to always keep God first, get a great support team, stay positive, cry, scream on days that you're not feeling your best, and just pretty much tell yourself that tomorrow is going to be better. And just know that you're younger, you have a lot to live for, and just stay motivated, stay encouraged. And just always, when you're weak, just find somebody who's strong in your corner to encourage you and to uplift you, and just continue to pray throughout the day.
I ask my patients 5, 10 years out, I'm like, what's the one thing you learned from this journey? And you know what they tell me? A lot of them will say, my priorities were so screwed up before I was diagnosed. And now I enjoy everything. And my life is better because I am enjoying little things that I took for granted before.